Welcome to IM Updates. This is Yen. In this episode, we'll cover key international guideline updates, new FDA approvals, and real clinical changes in practice from March 30th to April the 3rd. Here's the overview. First, on April the 1st, Infectious Disease Society of America released guideline update on the treatment and management of COVID-19. They refined antiviral recommendations for mild to moderate COVID-19 based on patients' risk of progression. For nirmatrelvir, ritonavir, or Paxlovid, the panel strongly recommends it for high-risk patients, conditionally suggested for those at increased but not high risk, and suggests against routine use in those without risk factors. The same three-tiered approach applies to remdesivir or Veklury. While for molnupiravir or lenacapavir, the panel suggested only for high-risk patients who had no other treatment options. On April the 1st, the American Society of Clinical Oncology released Systemic Treatment of Thyroid Cancer Guideline. A bit of difference has been made compared to 2025 ATA guideline. For patients with BRAF V600E mutated radioactive iodine refractory differentiated thyroid cancer, lenvatinib is reasonably considered frontline therapy due to high response rate, a longer median duration of response, and progression-free interval than BRAF/MEK inhibitors, although randomized comparative data remains lacking. For patients with BRAF V600E mutated anaplastic thyroid cancer, BRAF/MEK inhibitors targeted therapy, which is dabrafenib and trametinib, should be offered first-line, ideally as neoadjuvant therapy. On April the 2nd, American Heart Association released a scientific statement of advanced molecular, metabolic, and imaging approaches to characterizing right ventricular failure. It indicated a shift from treat the pulmonary arterial pressure to preserve right ventricular pulmonary arterial coupling. Recent studies suggest that right ventricular free wall strain may be superior to TAP-C2PA systolic pressure in predicting clinical outcomes in patients with pulmonary arterial hypertension. Promising treatments, such as the activin signaling inhibitor sotatercept, being approved by the US FDA as a novel treatment for advanced pulmonary arterial hypertension, which may reduce pulmonary vascular resistance and support right ventricular recovery. Beyond right ventricular centric view, recent findings also suggest that left ventricular eccentricity index improves review light to risk score. Move on to drugs and medication. On March 31st, FDA identified cases of serious liver injury in patients taking Tavneos or Vacopan for severe active ANCA-associated vasculitis. If treating patients who take Tavneos, healthcare professionals are suggested to monitor liver function and evidence of symptomatic cholestasis, and promptly discontinue it if there's an abnormality. Last but not least, let's talk about food. This week, the American Heart Association updated its dietary guidance, and the message is clear. It's your overall eating pattern, not single foods, that matters most. So what does a heart-healthy pattern look like? There are 9 key features. First, balance calories and stay active to maintain a healthy weight. Eat plenty of vegetables and fruits. Take the whole, not juiced. Choose whole grains over refined ones. For protein, shift towards plants like beans and nuts. Eat fish regularly. Pick low-fat or fat-free dietary. And if you eat red meat, choose lean cuts. Avoid processed meats like bacon and sausage and keep portions small. Replace saturated fats like butter and coconut oil with unsaturated plant oils like olive or canola. This is a big one. Choose minimally processed foods over ultra-processed ones. Think an apple instead of fruit bar. Cut added sugars, especially in drinks. Reduce sodium. Cook with less salt and try potassium-enriched salt substitutes. And finally, if don't drink alcohol, don't start. If you do, limit intake. because even low levels raise blood pressure and cancer risk. So start early, stick with it across life, and remember, small changes add up. That's all for today. Enjoy your weekend. See you next week.